Hello, everyone. I would like to begin by thanking the 2021 SU Undergraduate Research Symposium for giving me the opportunity to speak about my research. My name is Peter Gobran, and I am a third-year student in the Faculty of Kinesiology, and I will be talking about depression and physical activity within the context of the COVID-19 pandemic. So as I'm sure you all know and may have experienced, COVID has strained the mental health of Canadians all across the country. Even if we haven't experienced the virus firsthand, we've all been impacted in some way by the increased restrictions. For many, this has meant decreased access to fitness centers, which then has led to a decrease in physical activity levels. There hasn't been a sufficient amount of research so far observing how this is related to the increase in mental health issues. What we do know is that outside the pandemic context, physical activity has been shown to be associated with lower depressive symptoms. So our purpose was to determine whether pre-COVID physical activity is associated with depressive symptoms experienced over time during the pandemic. We also wanted to determine whether COVID-related changes in physical activity levels was associated with depressive symptoms experienced during the pandemic. So now looking at our study design, we had a sample of 283 Canadian adults from coast to coast who were recruited primarily through Athabasca University, as well as social media campaigns. So at study entry, participants filled out questionnaires where they stated how much physical activity they were engaged in pre-pandemic, as well as how much of a change in physical activity they experienced due to the pandemic. They also filled out the PHQ-9, which is a validated questionnaire which assesses depressive symptoms. It is worth noting that a score of greater or equal to 10 indicates possible clinically relevant depressive symptoms. Filling these out at study entry gave us baseline data that we could refer back to. They were then given the same PHQ-9 every 2 weeks for the next 6 months. So in total, they completed the PHQ-9 13 times. Now looking at the results, we can see here in this first graph, which is displaying pre-pandemic physical activity levels and depressive symptoms experienced during the pandemic. We have participants who had average levels of physical activity in the gray hash, high in green, and low in red. You can also see the black hash, which indicates the cutoff for symptoms that are potentially clinically relevant. So it's quite alarming how high some of these groups are. So there were differences at study entry between all three groups, with those having high levels of physical activity experiencing lower depressive symptoms, and those with low physical activity having high depressive symptoms, and those with average right in the middle. The decrease in depressive symptoms for all groups also lines up with the time in which government restrictions were lessened in the summer months. And you can see they go back up during the late fall and early winter when the second wave began and restrictions were increased. It is also worth noting that the differences in depressive symptoms between the groups at baseline persisted throughout the pandemic. Now we can see the graph displaying post-pandemic change in physical activity and depressive symptoms. So we have those who had no change in physical activity in the gray hash, those who gained activity in green, and those who lost in red. And once again, the clinical cutoff is in the black hash. We see here something similar to the first graph, with differences at baseline that persist throughout the pandemic. So those who gained physical activity due to the pandemic saw their depressive symptoms decrease throughout the pandemic, while those who lost seemed to have an increase in depressive symptoms as the pandemic went on. Those with no change stayed relatively constant, but they had a slight dip while restrictions were lightened during the summer months. With all this in mind, we can say that both lower pre-pandemic physical activity and greater loss of physical activity due to the pandemic were independently associated with higher depressive symptoms over the follow-up. This means that physical activity could be an important protector of mental health during the COVID-19 pandemic. These findings suggest that we should continue encouraging Canadians to engage in regular physical activity to both benefit physical health as well as mental health. I would like to thank my supervisor on this project, Dr. Kara Ross, as well as her co-PIs on the study, and Catherine Lowe, who is the project coordinator. I would also like to thank Athabasca University for providing the funding on this project. Thank you for watching.